Okay, so this was my framework for the pulmonary drugs, and I have to say this one was nothing short of an absolute banger. This exam was really hard. I was stressed preparing for it, particularly for this one, and I got some help learning these drugs, the side effects and everything. But just to keep them organized in my head, this saved me when I drew this up the first time and drew it a couple more times, and that really helped. So this is my framework for pulmonary pharm. I always like to divide things, as you may know, by head and neck, just like we did back in our anatomy exams. So exam 2 in anatomy was head and neck. So that's how the pulmonary drugs divide up. The drugs basically have two purposes. They can either be for the nose, which is head, or they can be for asthma and COPD, which are the airways. So I just put them as neck. I'm going to draw that in actually. Nose versus the airways. So that's head and neck. So I like that gives me a simple place to start so I can go from there. So I'm going to do head first. So it's nasal stuff. It's either nasal decongestion or it's nose inflammation, which is called rhinitis. But I like to call things what they actually are. So nasal inflammation. So they're both nasal things. The nasal decongestion is all about just fluid and blood flow to the area. So how do you reduce the amount of fluid in the nose? Congestion equals fluid, right? How do you reduce the amount of fluid in the nose? You reduce the amount of blood flow to the nose. And how do you do that? You constrict the vessels in the nose. So we know there are alpha-1 receptors do that. They cause constriction. So what I love here before I get into this alpha stuff is the whole framework for all of Pharm was autonomics versus inflammation. Just like the framework for all of Path is inflammation versus neoplasia, the framework for all of Pharm is inflammation versus autonomics, as in the autonomic nervous system, which is why I put a lightning bolt there for electricity, for nerves. Pharm framework. So this was something that I didn't pay attention to very much, not nearly as much as I did with Pharm. Like for Pharm, I'm always like neoplasia versus inflammation. For Path, I'm always like inflammation versus neoplasia. But for Pharm, I wasn't doing that as much, and noticing this here made me realize I should definitely do it more because it was a big help. So all these drugs, I realized, just group up into these two, which is really nice. So the nasal ones, well, both the head and neck problems can both be treated with autonomics, and they can both be treated with drugs that target inflammation. So we'll start, with the autonomics, both of them are sympathetic versus parasympathetic. So you have drugs targeting both aspects of the autonomic system, whether you're treating the nose or whether you're treating the airways. It's the same. So that symmetry is really, really nice. It was really helpful because it makes it easy to remember how to draw this thing out. I don't have to remember, is it sympathetic or what? It's both of them have both. The only difference is that the first one, the nasal stuff, which we put first because it's more minor kind of stuff, and then we go to the more legitimate stuff, or more, not legitimate, serious stuff. The first one has alpha sympathetic, and then the second one has beta sympathetic. So we'll do the nasal decongestion. You want to constrict so that you have less fluid in the nose. So you boost your alpha ones. You do it's an alpha-1 agonist. So you have the non-selective ones versus the selective, which are going to be like stronger ones that are working on more receptors versus more gentle ones that work on less receptors. So this non-selective is going to be alpha-1 and 2, whereas this one's going to just be alpha-1 that it binds to. So there were 3 of them, pseudoephedrine, and then 2 with zoline in the name. I don't remember what they're called. I just know they have zoline at the end of the name. I think it was metazoline was one of them. So those are the non-selectives. And then for the selective, there's phenylephrine. And I have my flower mnemonic if I remember that. This is the triangle for pseudoephedrine and the two zolines, the non-selective guys. So that's the sympathetic then versus parasympathetic. So the only parasympathetic for the nasal is the ipratropium. All of the antimuscarinics, I put it as parasympathetic. Why? Because it's acting on the parasympathetic system, right? It's inhibiting it, whereas these guys are boosting the sympathetic. I just grouped them by what they're acting on. I didn't specify whether it's boosting it or inhibiting it. That just goes with the logic of what's happening. So ipratropium is short acting. For the nasal stuff, since it's kind of more minor and whatever, it's not as big a deal as asthma and COPD, it only has a short acting one. Versus when we get to the asthma and COPD, the airway stuff, we're going to have short acting and long acting antimuscarinics acting on the parasympathetic. So they mirror each other, and they're also different. Like this has less stuff because it's nasal, it's very minor, versus this is more serious, so it has more stuff under the similar categories. And then of course beta versus alpha is a difference there. So I actually am going to keep this arrow because that's actually important. The fact that this is very minor and just less, and this is more severe, because that kind of affects how I remember it. So, okay, we can also treat nasal inflammation. How do we do that? So, you use anti-inflammatories. I'm not going to talk about the direct treatment first, because the way I organize it, it might not literally be that. I'm just going to talk about the drugs first. So for inflammation, the first thing I think of when I'm thinking about inflammation, I mean, maybe NSAIDs, right? But other than that, the first thing I think of is steroids. So that was actually the main one for this, and that's the one that goes in the middle. So you use steroids to treat nose inflammation, rhinitis, in adults. And I actually should have put that here. I forgot. In adults. So that means above the age of 12. So it's actually teens and adults. But I'm just going to write adults for simplicity's sake. Versus if they're below the age of 12. If they're kids, then you give them histamine. Above. Adults are above. In fact, I'll put children so that it can include, because I didn't include cromolyn on this when I first did it, but it can actually go there too. Crow's nose. Pirate's crow. So anyways, yeah, my whole thing with histamine, because it comes from mast cells, I think of mast cells as like pirates because it's like the mast of a pirate ship. So that's my whole mnemonic for it. So there's that. And then the big thing is that steroids are in the middle because they're like the main character of this, right? Adults are main, and then pediatrics gets like pushed to the side. Maybe not the best, but it kind of reflects reality, so it's easy to remember. I put the H, the big H for histamine, and then I put the big LT for leukotrienes. I wanted to emphasize the fact that leukotrienes has like a two-part name, leuko and trine. So since it has two names, that means it treats two diseases, right, for its treatment. You only use it to treat rhinitis, allergic rhinitis, which I think is what all these rhinitis are called. I just didn't write it out. Plus asthma. It has to be both. So if somebody has like allergic rhinitis, but they don't have asthma, you don't treat them with leukotrienes. If they have asthma but they don't have allergic rhinitis, you don't treat them with leukotrienes. So it has to be two diseases for you to use this. So two names, you have to use two diseases, and it's two classes. Not classes as in drug classes, classes as in classes in school. So the treatment is two diseases, treatment, smile. And then the side effects are two classes because it's both Pharm, which is what you would expect. This is Pharm. And it's also psych, though. It has an extra class. So that's where the people have, the side effects can include sleep issues, sleep/dreams, right? Sleep related stuff, and then like depression and anxiety. So like dreams and sleep are obviously related, so that's one chunk. And then depression and anxiety are the two most common psych complaints, like general psych complaints. So that's a really easy chunk to keep together too. And then the Pharm, oh, well, there's no Pharm side effects. It's just like, this is a drug, so of course, Pharm is like relevant to it. So it's like a second class becomes relevant, not just Pharm, but also psych when it comes to this drug. So 2 names, 2 diseases, and 2 classes. Leukotriene is all about the fact that it has 2 names. That's why I put the 2 letters for the 2 parts of its name. It has leuko and trine. It's like conjugate word or whatever. Whereas histamine is just, 1 word. And this is 1 word. So for steroids, there's first generation, second generation, older drugs versus newer drugs. So I say the older ones, they have more side effects because they have more bioavailability. But I tell myself, they have more side effects because they're older. They're not as good. Versus these modern, sleek drugs, they're like better. So steroids, bodybuilders take steroids and they always have a spray tan. So that's to remind myself that these are all administered via nasal spray. All the steroids, it's a nasal spray. So that's the spray tan. And then there's a whole mnemonic with like remembering which ones are second gen. Momo for the peach, CC, and then Flut. And then first generation, it's divided up by time. I didn't really talk about this thing of time, where asthma and COPD, asthma is all about acute episodes, right? Acute exacerbations, even though it's obviously a lifelong disease, so it's a chronic disease in that sense, but it manifests in acute episodes, so it's basically acute. And then COPD is chronic obstructive pulmonary disease, so it's chronic. So again, when I always do the thing space, time, to remind myself how time is a big, important organizer in medicine, acute versus chronic, we have that here. So I'm using the blue and the green for that. So you see it down here and everything, and you see it here. The first gens, see, there's different ones. Some of them treat asthma, some treat COPD. There was one called B-Su whatever. Oh, by the way, it's a steroid if it ends in, the way it's a steroid is that it ends in, or not ends in, it has like this in the name to some degree. So it might have just the so part, or it might have the own, or it might have the low alone or whatever, but it's either going to have own or like so. So usually own in the name uses a steroid. There's cyclesonide, fluticasone, mometasone, beclomethasone, and budesonide. Flunisolide, so the so is there, and then triamcinolone, the lone is there. So basically how I do it is the BC and BD for beclomethasone and budesonide. C comes before D, so it goes alphabetically as far as their timeline. This is the more acute one, this is the more chronic one. And that's me just saying acute as in asthma and chronic as in COPD, not saying they're literally, acute drugs or whatever. That's just how I remember it. And then Flun, I'm here for like a short, fun time, not a long time. So what was it called? Flunisolide or whatever. Yeah, flunisolide. So it's fun, it's short, it's asthma, not COPD. And then so it's like, I basically remember the BC and BD first because they're brothers, they're opposites, short versus long. And then I know that fun, BC has like one partner, fun, and then COPD has one partner, triamcinolone. Triamcinolone, remember it's a nasal route, but I already know all the steroids are nasal spray, so I didn't need that. But it was like before I knew that, I was trying to use that to remember that one, that this one is nasal. So those are those. That's all the inflammatory stuff. So I said that you treat kids with histamines. Well, there's a specific histamine thing that you use for a type of kid, but specifically newborns, or a type of child, but specifically newborn children. And that's the cromolyn. So I call it the crow's nose, and because pirates have like a bird on their shoulder, I say like, oh, the pirate has a crow on his shoulder and everything. So cromolyn is has to do with histamine stuff. Yeah, it's like the histamine stuff is divided into like, you know, attacking the mast cell, or, you know, stabilizing the mast cell so it doesn't degranulate, versus blocking the receptors. So basically, when the mast cell degranulates, that just means that the mast cell is releasing signals, inflammatory signals. You know, histamine, it's releasing histamine. So you can either, you can either block the mast cell from releasing the signal, or you can block the receptor from receiving the signal. Same sort of goal and effect either way, but the different drugs can target in different ways. And I didn't really like remember. I don't think I really like. No, I think I didn't learn it well, so like I already forgot which ones do which. But yeah. See, the cromolyn is the one that stabilizes the mast cell. And I remember I said it as like, oh, the crow is on the pirate's shoulder, and he stabilizes him. He keeps him calm, like. Don't worry, Captain. I'm your little crow. I'm keeping you like happy. And I'm like, oh, the baby's born. Every baby's born with their own little crow on their shoulder to like make them calm. So it's like it's literally stabilizing the mast cell. Like, don't degranulate, don't cry. Like, I'm here to stabilize you and make you happy. So I'm pretty sure cromolyn is the only one that acts that like stabilizes the mast cell. It's the only one that acts on the mast cell, and all the other ones act on the receptor. Yes, that's right. I just checked it. Perfect. So yeah, that's like. I thought so, but I wasn't sure. Now I'll be sure because I just explained it. They all act on the receptor, and then this whole thing of they're all histamine receptor antagonists, all of these guys. And then that's why it's histamine and not mast cell, right, is what I named the category. But the one exception is the unique, the unique crow guy. He can act directly on the mast cell. So instead of stopping the signal from being received, he stops the signal from ever being released in the first place. All others. So that's that. That's these guys. Oh yeah, and the root. They were divided up by root. So for the histamine guys, they all end in "ine." And I said, okay, if it's the mast cell, I always think of it as specifically the king of the pirates, Gold D. Roger, because he wears his pink cool jacket in that one scene. And pink is giving eosinophil, it's giving allergy, which is what histamine has to do with. So that just always works for me. And then because it's a pirate thing, it's like, whose crew do you want to be on, Usopp's or Luffy? Do you want to be on the nose crew, or do you want to be on the oral crew with his big mouth here? So, and his big nose. So it's like, there's only two Usopps. So it's like they're the nasal brothers. They're just two brothers, Ala and Olo. It's actually not called Ala, it's called Azalastine. But I removed the Z, and I just say alastine because it's a-lasting. As in it doesn't last because it's short-acting. Yeah, it's short-acting. And then the olopatidine, also ending in dine. Yeah, that's also in the nose. And that's also short, so I should have put that here. I didn't even notice that. Short. Yay. And then these oral guys are longer acting. So it's like I was rushing to like try to organize this stuff before the exam. Even now I'm seeing there's even more organization to it than I realized. Oh, shout out Ngozi also, because I forgot about this. I didn't group this into the framework. I just like memorized it separately. But I didn't even realize it actually perfectly goes under this because it's literally children. And that's what histamine is for. So it's perfect. Oh yeah, I forgot my mnemonic to remember that children are the histamine one is his pirate toy. Because I'm usually like, oh, his pirate crew for histamine because it's from mast cells. So I group them all together. Mast cells, histamine, pirates, right? Since mast cells release histamine. But it's like this time I say his pirate toy to remember that histamine is like for children. And then steroids, the main character, that's for adult. It's like the main thing is what the adults get. Sorry, children, you're an afterthought. That's how this society is structured. Anyways, so you have the nasal brothers and then the oral crew. And Zameen or Dean is going to be the ending, right? Because it's een. So the Dean ones were animals, a rat and a fox. Shout out Ngazi for pointing that out too, that they're both animals. So desloratadine, I say like, oh, this lowly rat wants to join my crew. Like, get off my ship, you nasty rat crawling on my freaking deck and trying to like be on my ship, pirate ship and everything. And then fox was like fox fetacine or whatever. And it kind of says fox fed in the name, even though it doesn't. It says fexofenadine. So it doesn't say fox or fed, but I kind of imagine it that it does. It's like a self-activated dyslexia thing, so it works. And then zamine is there. They end in zamine. They end in either zine or mean, is what I was getting at there. So cetrazine and diphenhydramine. There's only two of those, actually. I should just put them on. That's perfect. It splits to only two. So one of them is mean, one of them is zine. So it's cetirizine versus diphenhydramine. And that's the famous Benadryl that is allergy medicine that makes you sleepy. So it's it's a histamine receptor antagonist. And then now for the beta sympathetic and parasympathetic, it's autonomic, so obviously it has to split into sympathetic and parasympathetic, just like this guy. The only difference is this targeted alpha, this targeted beta on the sympathetic. So what are these? These are the beta agonists. Ooh, and they're both boosters. I don't think that's important to put here, to be honest, but this is an alpha agonist, not antagonist, and this is a beta agonist, not antagonist. So they're both agonists. Whether it's, airway disease or nose disease. But sympathetic, okay, acute versus chronic, SABA's short acting, that's chronic, right? I mean acute, obviously. So then you have LABA's, and again, this is not acute as in asthma anymore. This is just acute as in the vibe of, oh, it's short acting. So I know that I use it as a general framework, so I don't always literally mean acute when I say acute. But just so that somebody watching this doesn't get confused, I won't even say A and C. I'll just say short and long acting. Wait a second. No, why did I do that? I forgot. There's the reason, the connection actually works literally here. It's not just a mnemonic thing. The SABAs, the short acting, are used to treat asthma attacks because those are acute events. I'll even put that here to show that. So it's short acting. And then the chronic ones are used to treat COPD because COPD is chronic. So that's perfect. So it's split up by time, which also means it's split up by disease because the diseases are characterized somewhat by time. And it's the same thing for these guys. The ipratropium is short acting, so use it to treat an asthma attack because that's an acute short event, versus the other guys, all the other antimuscarinics, parasympathetic blockers, they're chronic, so they're long acting. Long versus ultra long, it splits up into two. Same thing over here. Yeah, good. Yes. See, so when it comes to like the autonomic stuff for asthma and COPD, you see how it's just way more complex than the nose stuff. The nose is just like whatever. We have a few alpha, then we have one parasympathetic. Versus the airway stuff is like, okay, both our sympathetic and our parasympathetic are breaking up into acute versus chronic. And both of our chronics are breaking up into long versus ultra long, right? Both of our longs break up into long versus ultra long. So you just see there's more complexity here, right, in this airway side compared to this nasal side, and that helps me remember it. So long acting are this pair, formoterol and salmeterol. Shout out Selma, my little. The F is for fast because formoterol is the faster of these two, and that is for whatever reason, like a fact like that you're supposed to know for tests and everything. So yeah, there's that. And then ultra long, shout out Min for this mnemonic. One of them starts with Vi, one of them starts with O, and then one starts with M. Of course, it has to end in terol because it's a beta agonist, just like albuterol, right? So it's like Vi, blah, blah, terol. It's like this, one of these. So she was like, oh yeah, that violin is playing way too long. So it's like, oh, I think of this pretentious guy, and it's way too long because it's ultra long. This pretentious guy playing violin, and he's like, yeah, I'm so awesome. Like, you can literally see how much he's feeling himself, and it's like, you're just like tired of it. Like, can you stop playing? You're not even good. So then when it comes to the parasympathetic, long versus ultra long, the ultra long are like, it's two insanely old guys that want to be respected. They're like, because they're insanely old, they're been insanely long living, you know. So one of them is like, revere me. So it's revemiclidium or whatever. Yeah, revemifednacin. So it doesn't even end in yum. That's the exception. Too bad. But the other one is, oh, I say like ooh me, like ooh and ah at me, because it's ooh me clidinium. Ooh me clidinium. So I say ooh and ah at me, and it ends in eum, which is actually spelled like this, eum, but I put it as yum because the antimuscarinics, a lot of like all of them except this one in this whole thing end in eum, and I change it to yum because they're acting on the parasympathetic, which means they're acting on the rest and digest system. So for digest, I'm thinking food, yum. So when I see yum, I think of like digest, and I know it's rest and digest. It's acting on the parasympathetic, so I know it's in this group. So they all end in eprotropium, tiotropium, whatever the G is, glycopyrronium, aclidinium, and oomeclidinium. So ooh and ah at me, yum. Because he's literally soaking up that adulation. He loves that, like, yum. So that's that. And then shout out Min for this one too. It's like playing video games, playing GTA, Grand Theft Auto. Like I've been playing Grand Theft Auto for a long time. But it's not as long as this horrible, pretentious guy that won't stop playing his thing. So that's like, to remember the GTA drugs starting with GTA are long. And of course, they'll end in yum because they're acting on the rest and digest system. So that was it. I think that was everything. That was my framework. This thing was like so, I did the Anki for like insanely long time. And because I was doing that for this specific one and this like set of drugs, and it was just like I could not like stop getting it mixed up, and I hated it, and I made this and I was so happy. I absolutely love it because it literally splits up so clean. Head versus neck, minor nasal stuff versus serious airway stuff, asthma and COPD. And then it's like they both split up into autonomics versus inflammation, which is literally like the majority of Pharm in general. And then both the autonomics split up into both sympathetic and parasympathetic, and they both do opposite aspects of the sympathetic, so they mirror each other perfectly. And then the age thing like matches up. This one has to be 2 names, so it's like a unique thing. It has to like treat, both the nose thing and the other thing. Oh yeah, actually I should do that. It has to be treating them at the same time, otherwise you can't use it. So yeah, there's that. It's just so beautiful. I literally love this one so much. So yeah, that's the end of it. And then the timeline thing. I want to look at the time myself to see how it, because I was overlooking like how often it can be used for this. So with the steroids, you use time at some point, acute versus chronic with asthma versus COPD for the first gen. For the histamines, you use time at some point because the different routes, the nasal route is faster and shorter acting than the oral route. So that's like most of inflammation. Obviously, you don't use it for leukotrienes because they just like have a specific case that they're used for. This, you don't use time for both of them because it's very simplistic and minor. But once you get over here for asthma and COPD, because the whole point of this is like asthma versus COPD, acute versus chronic, yeah, every part of it is split up that way. Both parts of it are split up that way. So that's good. That will help me remember that. What else? I forgot to say, like, this inflammation stuff. I was talking about how you use steroids to treat nose inflammation in children and adults. I never talked about it for asthma and COPD, so you might be thinking, why did I connect it to both of them? It's because when you give steroids or this anti-inflammatory stuff in general by itself, you're giving it for the nose inflammation. But when you're treating asthma and COPD with these beta agonists, you will often you're supposed to give steroids with it. Not these other things. Well, yes, this other thing, right? If it's both allergic rhinitis and asthma at the same time. Histamine, you don't really give for asthma or COPD ever. So that's like an imperfection in the thing, but whatever. I don't think of it that way, so it doesn't mess me up. But, yeah, steroids are like kind of more chronic. And I forgot to say, this is really important. Steroids are fat, they're fatty. They're lipophilic, which means they can pass through the nucleus, which means the way they exert their effect is that they actually go inside the nucleus and alter the DNA to cause the person to produce more beta receptors, more beta 2 receptors. Oh, well, actually, no. They do, that's one thing they do. But the primary thing they do is that they cause the person to create more. At low doses, they cause you to stop making so many inflammatory signals. And at high doses, they actually cause you to start making more anti-inflammatory signals. So either way, they're stopping inflammation at the level of DNA. They're literally changing the steroids change your DNA expression just to make you not do as much inflammation in your body. So that's why if it's taking the time to go all the way to the nucleus and do all this stuff and mess with DNA, it's obviously going to be slow acting. So it's on the chronic side. Basically, when you give LABAs and stuff for COPD, you give them with steroids. What's the idea there? So that's why the inflammation is also connected to this. It's through steroids. And I guess through this guy too, which is why this guy's on this side. That's why he's on the right side, and histamine is not on the right side because they're both close to that. Okay. The other effect, other than the anti-inflammatory stuff of steroids, is that they also make you make more beta 2 receptors, which, of course, literally enhances the effect of these guys, the beta 2 agonists. So it works perfectly. Also, I wanted to do it by alpha and beta, and I didn't want to put the numbers unnecessarily because I can figure out the number by like the mechanism. But just if we want to make it more juicy, this is alpha 1 agonist and this is beta 2 agonist. So just like the letter part is opposite, alpha versus beta, the numbers are also opposite, 1 versus 2. So I guess I'll include that since it works so neatly. So yeah. That's it. There's also the cough ones, but I did that separately. So there were the cough drugs, so antitussives, drugs against cough, so I'll do that here. Let's see if I can even remember it. That was like more of a side add-on I did at the last second. Opioids versus non-opioids, codeine versus hydrocodone. Codeine, that's lean, the purple stuff. If you listen to rap and everything, you're one, depending on the type of rap, young, modern, they might have mentioned that. Then you had the other ones. Dextromethorphan. I call it, I'm just gonna put this one is not really much of a framework as much. I'm just gonna put my mnemonics so I can remember them later. Dexter's Laboratory. So it binds to something that has a name that seems like something out of Dexter's Laboratory, and that's N-methyl D-aspartate. So when I look that up, expecting actual words, I just get all these random letters, N-methyl D, and it's like this long, complicated, confusing chemistry thing. So that literally seems like something that came out from Dexter's Laboratory, from Cartoon Network, because it's just complicated. So it's NMDA. That's to remember that the dextromethorphan acts on NMDA receptors or something. This thing, hydrocodone, is like more potent than codeine. So, I mean, it's hydrocodone, but I call it hydrocodone because it's like hypercodeine. It's just like a more amped up version of codeine. So I spell them the same to make it easier to group them together, even though it's hydrocodone technically. Then Dexter, oh yeah, I remember now. Dexter, you're supposed to be in the middle of the triangle, because the other two are like a pair. They're a yin yang. Why? Because they're both ben. So you have benzonatate or whatever. Basically, it was like Ben and Ben. So you have benzonatate and Benadryl, which is of course diphenhydramine, or as I say, drill phenhydramine. Di turns to drill to remember that it's Benadryl. So this has drowsiness side effect, blah, 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 allergy medicine, stops coughing, also can stop some, you know, some other problems. Yeah, it can stop like the nose allergy in kids and everything. This thing acts on sodium channels. That's why it has the Na in the name. I should like learn these better, but I don't really know more, but that was just what helped me to at least know what I knew. So that's it. That's it.